you're about to start your pediatrics posting or you have already started your posting, then you need to watch this video to the end. In this video, I'll be explaining to you what exactly your pediatrics posting entails, what to expect, and how to successfully ace your posting. Hi, if you're new here, my name is monimeetsmed and I am a final year medical student. I upload medicine and lifestyle content on my channel, so if that is the kind of content you are interested in, then ensure to subscribe. So without further ado, let's just jump straight into this video. Pediatrics is the specialty of medicine which focuses on the care and management of children and the diseases associated with the children. I'm currently in my final year in medical school, and I can say that so far pediatrics posting would have to be my favorite posting. As much as I enjoyed pediatrics posting, it was also very demanding, and that was because we would have lectures in the morning, ward rounds, would stay during ward rounds on clinic for hours, then we would also have seminars, we also had to go for our calls, and then we also had to collect patients as well. And on top of everything, we still had to keep up with trying to sign our logbooks. So with all of that, it made the posting very tedious, but it also made the posting interesting in the sense that there was a lot of things to get involved in. For this video, I'm going to focus on three main aspects of the posting, which is the lectures/study section, the clinicals, and examinations. Concerning lectures, I do want to highlight the fact that there are a lot of topics to cover in pediatrics, and so my first point I want to make is to start studying early. I don't know how the setting is like for you, but I know for me, we had lecture slides to study, also had seminar topics to study, so I split into groups and we had seminar topics to discuss. Because of the large amount of work, it is important to start studying early, study consistently. Another important tip I have concerning lectures and studying would be to pay attention during your lectures. Even I still struggle sometimes to pay rapt attention in class. It's very easy to get distracted during lectures, but I have noticed that if you give your rapt attention during your lectures, your lecturers are going to highlight very important points during lectures. They're going to highlight stuff that you need to know. They're going to highlight certain areas of concentration for tests or examinations. They're going to highlight, or they could just give examples of certain clinical scenarios, and you could just find it during your tests or exams. Paying rapt attention during your lectures is very important, so you don't miss important things that your lecturers mention. Whatever study methods you are using for yourself, ensure to implement active recall and spaced repetition. So adapt your study methods for yourself to be able to recall what you studied previously again and again. For the clinical aspect of your posting, that involves you going to the ward, clerking patients, attending ward rounds, attending clinics. Depending on the way your school does clinics, you might also attend immunization clinics. I know for my school, we usually have immunization clinics every Wednesday, which we had to attend. Also, I do want to explain that when it comes to clerking in pediatrics, clerking in pediatrics is not as straightforward as clerking in medicine, because with pediatrics, you are clerking, first of all, it's a child that's involved, obviously, but first of all, you may not be clerking the child, you most likely be clerking the caregiver, so that could be the mother or a relative. And so when you are clerking the relative, you have to make sure that whatever you are asking in plain, simple English for the person to understand, because the person isn't necessarily the one having the symptoms, but they are the ones that notice the symptoms. So you have to ask the questions in a plain English so that the person can understand and give you accurate information. Also, with clerking children, the pattern of taking history or the pattern of their history is a bit different. So instead of just taking their presenting complaint and taking a detailed history, you might also need to take other histories depending on what the patient presents with. So you may also need to take history such as antenatal history, you may need to take immunization history, you may need to take developmental milestones, you may need to take nutritional history, again depending on the symptom that the patient presents with. So in that aspect, clerking in pediatrics differs from clerking in medicine. Also, when taking these various aspects of the history, there are certain questions that you are supposed to ask. So during the postings, as you go along, the more you practice, the more you ask these questions, the more you get used to it. So this is going to drive me to my next point, which is during your postings, get involved. So if you are paired with people to go and clerk a specific patient, don't just stay behind and say, okay, these are the people that are clerking, and me, I'll just wait to collect the clerking and just copy it down. But you should try to get involved. If it's 3 people, all 3 of you should be asking different questions to try to, clerk the patient and reach a diagnosis together. When it's time to examine the patient, you could take turns if you can. If it means maybe examining a patient and then the next time another person examines, so that every single person can get experience with examining patients, so you can also improve your skills, then do that. When it's time for ward rounds, attend your ward rounds. When it's time for clinic, attend your clinic. During your ward rounds, ensure to take notes of whatever will be discussed, and after ward rounds, go over the notes again, look over those cases. My next point is very, 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 very important. If you didn't take anything from this full video, just take this one to your heart. Take your logbook very seriously. What did I say? Take your logbook very seriously.
Go and fill your logbook. Go and fill your logbook. Go and fill your logbook.
For the people who are not too familiar with what I mean by logbook, in medical school, at the beginning of every posting, every medical student is given a specific book, and it is called a logbook. And in that logbook, there are certain spaces which you are supposed to sign. So there's usually spaces for your ward rounds, for a clinic, for lectures, depending on what your department chooses to do, and procedures as well. So it has space for presentations. So whenever you present a patient on the ward, there's going to be a space where your consultant signs it. So that is what logbook entails. A logbook carries a specific percentage of your CA. Depends on the school, what your school decides to do. I know ours held just a bit above 50% of our CA. I think ours was 60%. Attend your ward rounds, attend your clinic days, for your calls. Do everything you need to do to sign your logbook. Whatever it is you're supposed to sign, be it ward rounds, clinic, procedures, make sure to attend them and sign them. As much as possible to sign your procedures, and sign your procedures by yourself. Don't give your friend your logbook to go and sign for you. Some of you are already looking at me, giving me side eye.
Bombastic side eye. Criminal offensive side eye.
I know a lot of us can get very caught up with trying to sign logbooks for the sake of signing so we can fill it up, but I will say that as you are trying to sign procedures, take note of those procedures that are being done and how to actually do them. So let's say, for example, if you are looking at a lumbar puncture procedure, don't just go and look at the lumbar puncture procedure, but actually take note of how it is done, the steps that are taken. One of the reasons I actually really like pediatrics was the fact that our logbooks, there were spaces for just watching or assisting a procedure. So obviously if you assist a procedure, it gives you a bit higher mark. So also got the chance to assist a couple of procedures. Where you can assist procedures is good for you, because you kind of learn how to do the procedures, and it's also good for your logbooks. Examinations usually entails the written aspect, which is SBA or multiple choice depending on what your school sets, and the theory. The next aspect would be the OSP, which is the picture test, and the third aspect would be the OSCE, which is the clinical aspect of the examination. The written part of your exams, studying your notes, but also using past questions. Studying past questions for the patterns in which questions are asked. So we go through past questions, you notice that okay, this lecturer likes to ask this specific question, or they usually ask questions around this area. So taking note of the areas that they focus on, but also not depending on past questions. So past questions are a guide, but just in case they decide to set something different for you, then you should prepare for that as well. For the OSP, you'll be shown different pictures and you'll be asked questions on them. So these pictures, they usually entail things that either you've seen on the ward, they could be instruments, they could be pictures from your lecture slides. So depending on whatever topic it is, they could just take pictures from there and ask questions. So this is why studying your notes is very important. You have an idea of how to answer those questions. And the last part of the exams, which is probably one of the most important, which is the OSCE aspect of the exams. This is the clinical aspect. So in this aspect, you'll be tested on every single thing you've been doing from the beginning of the postings to the end in the ward. Clicking patients, you'll be tested on that. In that case, they could bring, okay, this patient presents with this symptom, click or take a detailed history. They might even narrow the history taken down to nutritional history, because I know that during my exams we're told to click a specific symptom, and then we're also asked to take a nutritional history for a specific case. So they could narrow it down to that, which is why you need to know the questions you're supposed to ask for all of those histories. You could also be asked to examine your patient. It could be cardiovascular examination, respiratory examination, ENS examinations, or whatever. So during your postings, make sure that you've been examining patients in the ward. Also before the examinations, practice. Meet your friends, practice how to do those examinations. We'll leave a couple of videos in the description for how to examine, so general, physical, abdominal, and whatnot. There are specific videos that I know that I watched that are very, very helpful, so I will link them in the description box for you. There could also be other stations such as counseling stations. So they could bring specific scenarios and say, okay, counsel the mother of the child depending on what the child could present with. So maybe things like counsel a mother who just discovered that her child has sickle cell anemia, learning how to counsel, which also has a system as well. So there is a principle for that. Again, you should know the principle so that you follow that step. Could also be management of emergency cases in pediatrics. There are common emergency cases in pediatrics which you're supposed to know. So during your postings, your lecturers will definitely highlight them for you. So take note of them. They are very, very important. The procedures that you may have been signing in your logbook, take note of them. Just take note of whatever procedures you've seen on the ward. Like I said, don't just go for going sake just to sign, because they may ask you to actually carry out those procedures. If you're in a position where you can actually practice them in your school, practice them so that you can get the hang of it. Yeah, I think I have covered every single thing that I need to cover for this video. If there's any other thing you guys need clarity on, you can comment them in the comment section and I'll answer you. If you know anybody that is currently in their pediatrics posting or is about to, please share this video with them, because I think they'll find it very helpful. Thank you so much for watching. Hopefully you enjoyed it. Please do not forget to like this video and subscribe to my channel if you haven't already, and also share this video again to whoever will need it. So I'll see you guys in my next video. Bye.